Good afternoon, and welcome to my Friday message. This week, we see the One Duke approach in action, advancing science and patient care and building healthier communities. More than 1 year after the first in-human partial heart transplant, Duke surgeons have found that baby Owen's implanted heart valves are well-functioning and growing along with him, supporting the rationale behind the groundbreaking approach. The landmark achievement, led by Dr. Joseph Turek, Chief of Pediatric Cardiac Surgery, not only decreased the need for repeated surgeries inherent in prior use of porcine valves, but has the potential to increase the number of children that can receive heart tissue for transplants. This clinical breakthrough has been published in the Journal of the American Medical Association as a preliminary communication. Another group of Duke physician scientists have participated in a multi-center study to better characterize the complex inheritance patterns for kidney disease. In addition to the genetic variants that contribute to some types of racial and ethnic disparities in kidney disease, investigators identified a genetic variant that may be protective against the disease in some African American individuals. Chronic kidney disease is 5 times more common in people of African ancestry, and this study, published in Nature Communications, has significant implications for diagnosis, clinical treatment, and the allocation of kidneys for transplant. This was a multi-institutional effort that included a team from Duke led by Rashid Gadabishan. In community news, last week we announced a transformative new partnership between Duke Health, Durham Technical Community College, and Durham Public Schools that will provide career opportunities for hundreds of our community's young people and at the same time help meet clinical healthcare workforce needs. The Health Sciences Early College, funded with a grant of $29 million from the Bloomberg Philanthropies, will provide specialized training for students and a pathway to employment in clinical care areas and clinical research at Duke Health. This unique curriculum builds on our existing partnerships with educational colleagues in our community. It's a great opportunity to come together to invest in the future of our students, the workplaces they will join, and the health and well-being of the community we serve. As we celebrate this investment in the broader community, one of our internal programs is also getting outside recognition. The School of Medicine's Strategic Communications and Equity, Diversity, and Inclusion teams recently won a Gold Award for Excellence from the Association of American Medical Colleges Group on Institutional Advancement. The award honors the creative reimagining of our EDI website, with the judges identifying the EDI data dashboard specifically as best practice. The website is a wonderful resource for the School of Medicine community. If you haven't seen it, I recommend you visit the site and experience it yourself. It's always special to receive recognition from your peers. In additional local news, the Duke Regional Biocontainment Lab, a vital hub for research into infectious diseases, is gearing up for the future under the leadership of their new director, Herman Statz. Dr. Statz, a professor of pathology, took the helm of the RBL on January 1st. The lab, a key resource for Duke Human Vaccine Institute, also recently received a significant boost in funding from the National Institutes of Health. Lastly, the great kickoff celebrating the Duke Centennial on January 9th was just the first of many occasions to highlight the best and brightest of Duke throughout the year. Starting on January 29th, the Duke Centennial Research and Innovation Week, several of our School of Medicine colleagues will be presenting in various sessions. Then on January 31st, Dr. Rajiv Shah will deliver the 2024 Victor Zhao Distinguished Lecture in Global Health. Dr. Shah, president of the Rockefeller Foundation, will lay out his big bet mindset in approaching public health challenges. On February 9th, Duke Health hosts area scholars for the Marianne Black Distinguished Health Equity Symposium. Dr. Mary Bassett, director of the Francois Xavier Bagnot Center for Health and Human Rights, will deliver the keynote address. We will then mark 10 years of the Robert J. Lefkowitz Distinguished Lecture on Tuesday, February 13th. Dr. Akiko Awasaki, the director of the Center for Infection and Immunity at Yale School of Medicine, will address the immunology of long COVID. And finally, please continue to monitor the recommendations of our infection prevention experts concerning masking and hospital visitation restrictions. Happy Friday, everyone, and thanks for all you do.